Hi everyone, my name is Eliza Wheeler. I work for the Drug Overdose Prevention and Education Project, the DOPE Project, and I'd like to thank you all for coming out for Overdose Awareness Day and being here. We're going to have a few minutes of Tom saying something and then we're going to get started. Thank you.
Good afternoon, everyone. Welcome to a beautiful, beautiful afternoon in San Francisco. My name is Tom Jackson. I'm a legislative aide to Supervisor Chris Daly's office, and we're happy to sponsor this press event today. Our office would like to welcome you to the International Overdose Awareness Day. On August 31st, 2010, we are acknowledging all the people that have overdosed and also all the people that have been saved. This issue affects all of us across socioeconomic classes, ethnic backgrounds. Everyone's subject to this phenomenon. However, it is preventable. Overdose is preventable when the right support and services are available. So we're taking this time to recognize some of the great work that the Harm Reduction Coalition is doing on this matter. And without further ado, let's hear from the folks that are involved in the work. Thanks so much.
Okay, I'd like to just start by asking for a quick moment of silence just to acknowledge the folks that are not here today who we have lost to overdose, and then I'm going to say a few words. So if we could just kind of give a moment of silence. Thank you. So 11 years ago, I lost my friend Brian to heroin overdose. He was the first of many friends of mine to die too early of something preventable. Following Brian were Ariel, Billy, Paul, Brandon, Justin, and the list goes on and on. I'm here today to remember them, but also to celebrate all of the lives that have actually been saved by courageous people who have taken the time to learn how to help their friends who are overdosing. The DOPE Project, where I work to train people to use naloxone to reverse an overdose from drugs like heroin or OxyContin, has trained over 2,200 people to save their friends, family members, partners from an overdose. Since 2003, we've had 500 people report using these skills in the naloxone distributed by this program to save their friends' lives. These are 500 people who would not be alive today. Often we hear from critics of overdose prevention programs that these are not lives that are worth saving, that because someone uses drugs, they deserve to die. I believe that every life is worth saving, period. I often speak with my friend Brian's mom, still to this day, and the thought of someone saying to her that losing her son was in some way okay or deserved makes my stomach turn. In honor of my own loved ones who I have lost to drug overdose and the tens of thousands of others who die every year in this country from accidental overdose, I will continue to advocate for programs like ours that are able to get naloxone into the community where it's most needed. In closing, I just would like to thank all of the people that have worked with this program over the years and who have, most of all, the folks who have revived their friends, family members, and partners using naloxone. You have taken the time and care to learn how to save your friends' lives. We would also like to extend our appreciation to our community partners that work hard to reduce the number of fatal overdoses in our community. San Francisco Department of Public Health, Dr. Bamberger, the San Francisco AIDS Foundation, HIV Prevention Point Needle Exchange, the Homeless Youth Alliance and San Francisco Needle Exchange, the Forensic AIDS Project at the San Francisco Jail, Women's Community Clinic, Mission Neighborhood Resource Center, the SRO Collaboratives, and finally to Rachel McLean for starting this project, and in memory of Pete Morse, who also was one of the people who founded this project, and unfortunately he's not here with us today. So in closing, thank you all for being here, and we're going to have a few people come up and say some words. Is Dr. Bamberger here?
Yeah.
Oh, he's making an entrance. Well, while he's crossing the street, I'll introduce him. So Dr. Bamberger works for the Department of Public Health and the Housing and Urban Health Clinic, and he writes our Narcan prescriptions. So, thank you.
Hi. Good afternoon. I'm Joshua Bamberger, and it's really great to be able to be here today to recognize that we've had 500 reported saves with naloxone, which is a non-controlled medication that is able to, almost every time someone has a heart beating that it's used, will reverse the effects of an opiate overdose. You know, with the health department in San Francisco, I think we can pretty much say that we would prefer a San Francisco where there are not people suffering from addiction to opiates. I think that's our goal, and we strive for that every day. But to achieve that, sometimes people have to first survive to be able to get into drug treatment. And the way it works is that death from heroin overdose is still the leading cause of death for any opiate users between the ages of 20 and 50 here in the city. So many young people are still dying because of the effects of addiction. And if we're going to make headway on getting people to not come to harm from opiates, we need to keep them alive long enough so that they can get into treatment and reduce their harm and survive long enough to thrive. So that's our goal, is so that people don't use opiates, but if they are using, we hope that we can keep them alive long enough so that they can get into treatment and reduce harm. And it's a pleasure to be part of this. It's a great day to be able to recognize all the work that has come in from the years of toil among the harm reduction community to reduce harm and to keep people alive. So thank you, and it's great to represent the health department in promoting the fact that all these folks have worked for so long to keep people here today. Thank you.
Thanks, Josh. So one of the greatest things about the DOPE project is that we have an amazing team of people that go out into the community that provide overdose prevention education and give out the naloxone at our different sites. And many of us who do the trainings have personal experience either with drug use or losing friends. And one of our amazing trainers is going to talk for just a minute, Paulie, and I'd love for him to come up and kind of talk about working with the project and doing overdose prevention.
Hi, y'all. It's nice to see you. It's an honor to be able to talk from, with my cohorts here. I wanted to say a couple quick things. One is that I got saved with, I'm already out on this stuff, so I got saved with Narcan once, and I've saved 2 people that were dead. I mean, like blue, not breathing, dead. People that maybe 2 of the closest people in my life, and it's an amazing feeling. And it's a real sad thing that you have to put dollar amounts on human life, and but we have to do that apparently, according to the way things are. And this is the best bang for the buck. How much money is 500 lives worth? And how much money does the Dose Project ask for? And I'm so passionate about this, it's just amazing. Because you really, if you look in the big picture, that I think this is the most effective program that I can think of. And also, I've had a lot of people that I've trained. I've been there a long time. I've been able to be lucky enough to work with these people. And to have people that are, it's tough out there. I was out there 20 years ago. It's really tough out there. And to be able to save we're the San Francisco model, we're about empowering people to help themselves. And there's nothing more empowering than saving a life. And we had 500 people that went out there and did that. And they come back, and it's incredible the difference that it makes in their life, and the light in their eyes and the looks on their face. It's amazing. It's such an honor to be here. And the Dope Project is my favorite. 500 lives is just amazing. There it is, period. There's no gleaning of the numbers. That's just a statement. 500 lives saved is the best. Thank you.
All right. So another way that we would not be able to do what we do is without the amazing organizations in San Francisco that host the DOPE Project to come and provide overdose prevention and give out naloxone. And one of our most amazing community partners is here today. Laura Guzman from the Mission Neighborhood Resource Center, where we work every week at Ladies' Night to provide overdose prevention to the women of the mission. And she's going to speak a little bit about the impact of overdose prevention on the community. Thank you.
So good afternoon, joy. I think it's a joyful day for the harm reduction community. And as director, I have to say I stand here both honored and proud. Honored because we have partnered with the DOPE since we opened in 2002. And as you know, Mission was and still is one of the epicenters of heroin overdoses in the city. I can say that 8 years later, we have had 0 overdoses at the Mission Neighborhood Resource Center thanks to the DOPE project. We managed to train our staff every year as a mandatory training, and we have been training the community in English and Spanish every year at the DOPE Come and Does presentation for our interns. Most importantly, we joined, thanks to the pioneer efforts of Dr. Bamberger, we joined to do prescription of Narcan, and we do it every month now. And I just found out that we have registered 100 women who are naloxone users this day in the mission. And in this year, we have saved 8 people's lives in the mission thanks to naloxone distribution, so we're so proud. And the other reason why, well, can we fix it now? No? I can do it without it. Yes? The other reason, let me see. I'll do it. So the other reason what I think we should be so proud is because we really can do it as a community. And I think that probably of all the interventions we've done in the city, this has been one of the most amazing collective harm reduction interventions. With the Department of Public Health, with the Harm Reduction Coalition, the needle exchanges, and community-based organizations, we can demonstrate that we can together make interventions that save drug users' lives. To close, I want to say the efforts need to continue. We have to vote for 2 overdose bills that are right now in Sacramento that will allow to have safe distribution of naloxone and also the 911 calls so nobody goes to jail for saving people's lives. We also have to assure that we pass bills that are related to legalization of marijuana, and most important, that we tell the Obama administration that we really need to end the ban to needle exchange and get funding and end the war on drugs, which is killing too many of our people, and right now is spreading genocide in our brothers and sisters in Mexico. Thank you very much.